Bruce Elliott. I work for NHS Digital in an education role about making the most of technology, but I'm also a Diabetes UK patient champion, and I received a great accolade from Diabetes UK last year for my work in championing digital as a kind of means for actually improving your self-care and self-management. Well, it was called the Diabetes Aspire Award, so it's just again to try to get people actively involved in campaigning and supporting and volunteering for Diabetes UK. Well, what it was about was, and this is where the real digital story begins, it was about trying to encourage members of Diabetes UK and within patient participation groups to work with the patient participation groups to gain access to the records themselves and understanding of how they can manage that condition. And what that really stemmed from is one of the things that I'm very lucky in my job about was originally I was recruited to try to help people network and share good practice throughout the health service, just like Wiz does on a far grander scale now within it. And I was recommended to go to see a GP called Amir Hanan, who'd taken over from Dr. Harold Shipman and wanted to rebuild what he called a partnership of trust with his patients. And Amir worried me a bit to start off with, because he agreed to actually host an event, but he didn't want it in a local hotel, he wanted it in his practice. And then he said, and I'm not going to be there all morning because I'm going to be in with my patients, so I'd like members of my patient participation group to run it. And I was really perplexed at this because I had lots of managers in very senior roles coming along. I thought, I know I'm a patient myself, but I don't know if I trust patient stories. Will they resonate as much with the kind of audience that we've got coming along? But Amir was quite insistent, and on that morning I trundled along at 8:30 to the health promotion room in the Horton Thornley Medical Practice, and I was greeted by some members of his patients participation group. People like Yvonne Bennett and Margaret Rickson were there to meet and greet. They were doing all the teas and coffees for everybody, and as soon as they started speaking with me and telling me their stories, I automatically felt at home, and it resonated with me more than any of our national policies, because they told about their heartfelt experiences. In terms of some of those experiences that really resonated with me was one by a lady, and I won't quote her name specifically within it, but she mentioned her mother had been a victim of Harold Shipman. And again, with it, they had great trust in Dr. Shipman, but none of them had any idea of what was actually really going on within the treatment. And there's a lot of worry and scepticism about what actually happens with patient records when they're shared electronically, about how they might fall into the wrong hands and that sort of side. And she gave the reassurance to us that day, and she said, if you tell me about the risks involved in sharing the records electronically with your patients and with other people involved in their care, said, well, I'll tell you how minimal those risks are. Since my mother's records were found in a shoebox, in a cereal box in Harold Shipman's garage. And it got to me over the concept of it's about how you build trust and the systems we can actually build in that help facilitate that. I thought, yes, I want my records to be shared with my family, but more particularly with me, and so I can understand and manage the condition, and so that people around me who might care for me can actually understand that way. And it was the words of people like her and Yvonne Bennett, who was the secretary of Patient Participation Group, Margaret Rickson, who's now sadly died from that, and also Ingrid Brindle, who's now the chair of that group, that have made the difference, and they've motivated me to get access to my own records and to try and use digital as a tool to help my mother-in-law manage her own care, and my son and all my family. And I don't do it very well, but I'm going to keep trying to do it thanks to the stories that they shared with me.